morning, dear students. Today, under chapter number 8, Human Health and Diseases, we are going to solve the board questions based on the topic drug and alcohol abuse. So, let's begin. What are drugs? So, drugs are actually medicines. When we take these medicines for purpose other than medicinal use or in amount or frequency that impair our physical, physiological, or psychological function, it is known as drug abuse. So, we are going to study about certain drugs which are commonly abused. They are, first is opioids. Opioids, they are analgesic. Analgesic means they are strong painkillers and depressant. They act on our central nervous system and gives a feeling of relaxation and drowsiness. Opioids are obtained from poppy plant. The scientific name of poppy plant is Papaver somniferum. So poppy plant, it produces capsule. This unripe capsule, from this the latex is obtained. That latex contains codeine and morphine. Codeine and morphine, these are the two natural opioids. Codeine is a mild analgesic. On the other hand, morphine is a strong analgesic. Analgesic, painkiller. Codeine is used in cough syrups. And morphine is given at the time of surgery to relieve the pain which occurs due to surgery. When morphine its acetylation is done, we obtain synthetic opioid that is known as heroin or smack. It is also known as diacetyl morphine, which is highly addictive. Heroin is white, colorless, bitter, crystalline compound, and where it is acting, there are opioid receptors present in the central nervous system and gastrointestinal tract. So these drugs, they go and bind with these receptors and produces the desired effect. How it is taken? By snorting or through injection. Mode of action, it's a depressant and slows down body function. So in all the type of drugs, you have to study about the site of action, source of that drug, how it is taken and mode of action. ये main points हैं, इन्हें आप आपको learn करना है. Now let's see the questions based on opioids. First question is, name the source plant of heroin drug. So heroin आपका synthetic opioid है. So source plant, which is the plant that gives heroin. Okay. Then next part is asking, how is it obtained from the plant? Plant से हमें ये कैसे मिलता है? And B, write the effects of heroin on the human body. उसके effects क्या है? So source plant क्या है? Poppy plant, Papaver somniferum. How it is obtained? It is obtained by acetylation of morphine. And morphine is obtained from the latex of unripe capsule of poppy plant. क्योंकि हेरोइन सिंथेटिक ओपियोइड है, तो पहले मॉर्फिन ऑब्टेन करते हैं, मॉर्फिन लेटेक्स से मिलता है, उस मॉर्फिन का हम एसिटाइलेशन करते हैं एंड वी गेट हेरोइन और स्मैक. नेक्स्ट पार्ट इज आस्किंग, राइट द इफेक्ट ऑफ हेरोइन ऑन द ह्यूमन बॉडी. सो हमने पढ़ा मोड ऑफ एक्शन में हेरोइन इज अ डिप्रेसेंट एंड इट स्लोज डाउन द बॉडी फंक्शन. ठीक है. सेकेंड पार्ट, द क्वेश्चन कैन बी आस्क्ड इन दिस वे, नेम एन ओपियोइड ड्रग एंड इट्स सोर्स प्लांट. ठीक है. तो यहाँ पे कोई भी एक ओपियोइड ड्रग, तो आप उसमें मॉर्फिन भी लिख सकते हैं, कोडेन, और यू कैन राइट हेरोइन, एंड सोर्स प्लांट विल बी पॉपी प्लांट. The second part is similar to B. Okay. Next, name the plant source of the drug popularly called smack. So smack is the other name for heroin. Source plant, again same, Papaver somniferum. And how does it affect the body of abuser? It's a depressant and slows down body function. Third question. A group of youth were having a rave party in an isolated area and was raided by police. Packets of smack and syringes with needles were found littered around. मीन्स कुछ यूथ हैं जो पार्टी कर रहे थे और उनके पास से कुछ पैकेट्स मिले स्मैक और सिरिंजेस विद नीडल. Now, question is, why is taking smack considered an abuse? Okay, so taking smack is considered as abuse because it is highly addictive. If a person consumes it, it causes addiction or dependence on it. It is a depressant and slows down body function. Next is write the chemical name of smack. So chemical name क्या है? Diacetyl morphine. And the name of its source plant. Source plant is poppy plant or Papaver somniferum. Syringes and needles used by the youth for taking the drug could prove to be very fatal. Why? So जो syringes और needles हैं जो drug लेने के लिए intravenous drug injection के लिए जो use होती हैं, they can cause death. Why? Because when drugs are taken intravenously, the person is likely to acquire serious infection like AIDS and hepatitis B. Okay, so this virus, there is no cure for this disease and it may cause death of the person. So that is all about opioids. Next question is, name an opioid drug and its source plant. So it's same, that is anything codeine morphine, source plant is Papaver somniferum. How does the drug affect the human body? That is by slowing down the body function. Next category of drugs is cannabinoids. These are having hallucinogenic effect and depressants. Source of cannabinoid is plant cannabis sativa. Cannabis sativa की जो inflorescence है इससे हमें different type के cannabinoids मिलते हैं. Example of cannabinoids are marijuana, hashish, charas, ganja. They are produced by different combination of flower tops, leaves and raisins of cannabis sativa. There are cannabinoid receptors present in the brain where these drugs they go and bind. They are taken either by inhalation or oral ingestion. Mode of action, they affect the cardiovascular system of the body. तो इसके receptors आपके brain में हैं और ये cardiovascular system को affect करता है. Questions. Name the plant source of ganja. So all the cannabinoids like marijuana, charas, ganja, bhang, they all are obtained from cannabis sativa. And how does it affect the body of the abuser? It is a depressant and it acts on the cardiovascular system of the abuser. अब देखो दूसरा फॉर्म है क्वेश्चन का, from which plant the cannabinoids are obtained. So cannabinoids are obtained from inflorescence of the plant cannabis sativa. Name any two cannabinoids. So any two names you can write: marijuana, hashish, charas, ganja, etc. Which part of the body is affected? So cannabinoid receptors are present in the brain and it affects the cardiovascular system of the abuser. So next category of drugs are coca alkaloids or cocaine. These are stimulants. They stimulate our nervous system. And the source of coca alkaloid is coca plant. The scientific name is Erythroxylum coca, which is the native of South America. Cocaine is commonly called as coke or crack. It acts on the central nervous system of our body. Usually it is snorted. Mode of action, it interferes with the transport of neurotransmitter dopamine. and it has a stimulating action on our central nervous system, producing a sense of euphoria and increased energy. Excessive dosage of cocaine leads to hallucination. So this is the coca plant. There are other plants also which produce hallucinogens, that is Atropa belladonna and Dhatura species. LSD, lysergic acid diethylamide, is obtained from a fungus. It is also a strong hallucinogen. The name of the fungus is ergot fungus. Now, questions. Write a note on coca alkaloid. So, coca alkaloid, you can write all the points which we have studied just now. Coca is an alkaloid which is commonly known as cocaine, obtained from erythroxylum coca, and it is taken usually by snorting. It interferes with the transport of neurotransmitter dopamine. It stimulates our nervous system and produces the sense of euphoria and excess energy. Overdose of cocaine causes hallucination. So all these points covers everything about the cocaine or coca alkaloid. Next is name the plant source of cocaine. So plant source क्या है? Erythroxylum coca. How does it affect the human body? Again, it is stimulating our nervous system, producing a sense of euphoria and increased energy. Excessive dosage leads to hallucination. Name the drug obtained from erythroxylum. So this is the other way of asking question. Erythroxylum coca, and write its effect on the human body. So it is cocaine and effect will be same, stimulant, sense of euphoria and increased energy, and excessive dosage is causing hallucination. Name the blank spaces A, B, C and D in the table given below. So first column is asking for name of the drug, second plant source, and third organ system affected. So here the plant source given is poppy plant. Poppy plant से हमें क्या मिल रहा है? We are getting opioids like morphine, codeine, and organ system which is affected. So central nervous system. It is acting on central nervous system and is a strong analgesic and depressant. Second, marijuana. So marijuana, cannabis sativa, it's a hallucinogen, and effect is it affects cardiovascular system. Coming to the next category of drug abuse, that is tobacco. Tobacco is either smoked, chewed, or used as a snuff. It contains a stimulant known as nicotine. Nicotine is an alkaloid, and the release of nicotine, it stimulates adrenal gland to produce adrenaline and noradrenaline in the blood circulation. These both the hormones, they raises the blood pressure and increases heartbeat. Smoking of tobacco often leads to different type of cancer like lung cancer, oral cancer, etc., bronchitis, emphysema, and coronary heart diseases. Smoking of tobacco increases carbon monoxide content in the blood. Carbon monoxide has higher affinity for hemoglobin, thus it binds with the hemoglobin and reduces the oxygen transport inside the body. This affects the proper functioning of the body. These are the tobacco plants cultivated in the field. Now questions. How does smoking tobacco in human leads to oxygen deficiency in their body? So just now we discussed when a person smokes, carbon monoxide is produced and that amount increases in the blood, that binds with the hemoglobin, reduces the binding of oxygen with the hemoglobin and thus leads to decreased level of oxygen in the body. Smoking also damages alveolar walls, which reduces respiratory surface and causes emphysema. When someone buys packets of cigarettes, cannot miss the statutory warning that is present on the packing, which warns against smoking and says how it is injurious to health. तो सिगरेट के पैकेट्स पे वार्निंग रहती है जिसमें लिखा होता है कि इट इज इंजूरियस टू द हेल्थ, yet स्मोकिंग इज वेरी प्रिवलेंट इन आवर सोसाइटी. फिर भी लोग स्मोक करते हैं, both among young as well as old. Advise the adolescents about the importance of avoiding smoking. तो यहाँ पे आपको 6 points लिखने हैं about the why one should avoid smoking. ठीक है, तो स्मोकिंग के जो भी हार्मफुल इफेक्ट्स हैं वो हमें यहाँ मेंशन करने होंगे. तो जो स्मोक है, इट कंटेन्स डिफरेंट सब्सटेंसेस. One of the substances is nicotine, which is a stimulant that causes the release of adrenaline and noradrenaline into the blood circulation, which causes the increase in blood pressure and heart rate, which is not good for the health. Then smoking is associated with increased incidence of cancer of lung, urinary bladder, throat and oral cavity. It also causes bronchitis and emphysema. It is also associated with increased risk of coronary heart disease, gastric ulcer, etc. And finally, it increases the carbon monoxide content and thus reduces oxygen transport by hemoglobin. So this way you can write 6 points. So this was asked for 5 marks in previous board exam. Next topic, adolescence and drug abuse. So adolescence is the transition period between childhood and adulthood, where several biological and physiological changes takes place in the individual. Now, what are the cause of drug abuse among adolescents? So there are different points like out of curiosity, need for adventure and excitement, experimentation, stress, unsupportive family structure, peer pressure, the perception among youth that it is cool or progressive to smoke, use drug or alcohol. ठीक है, ये सारे पॉइंट्स आपकी टेक्स्ट बुक में दिए हैं. तो पॉइंट वाइज यू हैव टू जस्ट बाय हार्ट देम and if it is asked you can write. Okay, here it is given. The teenager or an adult uses any drug or alcohol. It may be because of curiosity or experimentation, but later the child starts using these to escape facing problems. Of late, stress from pressure to excel in academic or examination. So these points are given in textbook in detail. You can go through that also. Next is addiction. Addiction is what? Psychological attachment to certain effects such as euphoria and a temporary well-being associated with drugs or alcohol makes a person to take it again and again. So ये कुछ ऐसी feelings हैं जिसकी वजह से जो person है tries that drug and again and becomes addictive to that. Dependence. Dependence means tendency of the body. The person becomes dependent on the drug, and if the person tries to stop taking those drugs, then the body manifests certain unpleasant symptoms known as withdrawal syndrome. And if regular dose of drug or alcohol is abruptly discontinued, so such symptoms appear like nausea, giddiness. In some cases, these withdrawal symptoms, they can be severe and even life-threatening, and the person may need medical supervision. Next is effects of drug or alcohol abuse. So when a person starts taking drug or alcohol, there are some immediate effects. So immediate effect क्या है? Immediate adverse effect of drug and alcohol abuse are in the form of reckless behavior, vandalism, violence. Okay, then excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs or their intake along with alcohol. कई बार क्या है, अल्कोहल के साथ लोग दूसरी ड्रग्स ले लेते हैं, ठीक है, कोई मेडिसिन ले लेते हैं, generally results in overdosing and even causes death. Now, there are some warning signs, or you can say danger signs, which can be identified in drug abusers. The most common warning signs of drug and alcohol abuse among youth includes drop in academic performance. अगर कोई स्टूडेंट है वो ड्रग अब्यूज कर रहा है तो उसकी आप देखोगे कि उनकी जो एकेडमिक परफॉर्मेंस है दैट ड्रॉप्स डाउन, ठीक है, बच्चा स्कूल या कॉलेज से एब्सेंट रहने लगता है विदाउट एनी रीजन. देन लैक ऑफ इंटरेस्ट इन not maintaining proper personal hygiene, withdrawal, remaining isolated, goes in depression, fatigue, थका हुआ फील करेगा, aggressive, बहुत गुस्सा करेंगे, rebellious behavior, not following other parents or teachers' instruction, showing rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuation in weight, appetite, etc. So ऐसे symptoms देखकर parents should identify, parents, teachers, friends, they should identify that there might be some problem like drug abuse in the individual. So these are the common warning signs. So इनमें से at least 4-5 warning signs you can remember. नाउ वार्निंग साइंस है तो जो अब्यूजर है वो सिर्फ अपनी लाइफ को इफेक्ट नहीं करता है, द अदर्स हु आर स्टेइंग विद द अब्यूज दैट पर्सन, ड्रग एडिक्ट, देयर लाइफ इज आल्सो अफेक्टेड. सो देयर आर अदर implications of drug abuse like stealing. ठीक है, अगर अब्यूजर को मनी नहीं मिलेगा to buy the drugs or alcohol, so he may turn to stealing, वो चुराने लगेगा पैसा, ठीक है. Then the adverse effects are just not restricted to the person who is using drug or alcohol. At times, drug or alcohol addict become the cause of mental and financial distress to his or her entire family and friend. So, आपको याद रखना है immediate adverse effects क्या हैं. अल्कोहल के कॉम्बिनेशन में अगर हम ड्रग्स लेते हैं तो that may cause death. Then what are the warning signs seen in adolescence which indicates that the person might be abusing drug or alcohol? Then other than these warning signs, what other implications are there of the abuse? That the person may start stealing to get money to buy the drugs, or it becomes the abuser also affects the life of the family members by creating mental and financial distress to the entire family. Now, the use of alcohol during adolescence. ठीक है, alcohol, once the person become addicted to it, so it can finally lead to heavy drinking in adulthood. Okay, why this happens? Because initially the amount which is required to produce the desired effect, that requires small quantity of alcohol, but with time that quantity is not able to produce the desired effect, so the dose need to be increased, and with the time the dose increases to a very large amount and it leads to heavy drinking. The chronic use, long time use of drugs and alcohol, it damages nervous system and causes liver cirrhosis. In pregnancy, if the drug is used, then it causes adverse effect on the health of the fetus. Now, these drugs are also misused by sports person. This can also be asked as a question, how it is misused by sports person. So sports person, they use these drugs to enhance their performance, to increase the aggressiveness. They misuse narcotic, analgesic, anabolic steroids, diuretics, and certain hormones in sports to increase their muscle strength. ठीक है, performance increase करना है, muscle strength increase करना है, and to promote aggressiveness, and as a result increase their athletic performance. That's why if there is any doubt, these sports persons, they are subjected to medical test in order to detect whether the person has abused any drug or not. These drugs not only has some benefits, but they have certain side effects too, like anabolic steroids in females. Females में क्या side effects होते हैं? Masculinization, male type features develop in the female, increased aggressiveness, mood swings, depression, abnormal menstrual cycle, excessive hair growth on the face and body, enlargement of clitoris, and deepening of voice. Similarly, in case of males also, the steroids the drugs when they are abused, the males they also show certain side effects like acne, increased aggressiveness, mood swings, depression, reduction in the size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, and enlargement of prostate. Okay, so from this, three questions can be framed. First thing, which are the drugs that are abused by the sports person? So they are narcotic, analgesic, anabolic steroids, diuretics, hormones, okay, um, androgens, etc. Now, how they are benefiting them? Muscle strength improve करते हैं, performance improve करते हैं, aggressiveness बढ़ाते हैं, and athletic performance को improve करते हैं. Now, there are side effects of female and side effect of male. Now, ये जो इफेक्ट्स है, दे मे बी परमानेंट विद प्रोलॉन्ग यूज. अगर जो स्पोर्ट्स पर्सन है उसे लॉन्ग टाइम तक ड्रग का एब्यूज करता है, तो ये जितने भी सिम्टम्स हैं वो परमानेंट हो सकते हैं. In adolescent male or female, severe facial and body acne and premature closure of growth centers of the long bones may result in stunted growth. So adolescents में अगर ये abuse किए जाते हैं तो it may lead to stunted growth. ये short points हैं effects of drug or alcohol abuse that you can learn. Now, how the drug abuse can be prevented and controlled. So one should avoid undue peer pressure by education and counseling, seeking help from parents and peers, looking for all the danger signs or warning signs, seeking professional and medical help. Let's do the questions related to the topic. So question number 12. A doctor prescribed morphine as a sedative and painkiller to your cousin. आपके कजन को एक डॉक्टर ने मॉर्फिन प्रिस्क्राइब किया, जो सेडेटिव है. सेडेटिव मतलब जो स्लीप इंड्यूस करे, जो डिप्रेसेंट होता है, एंड पेन किलर. हु हैड अंडरगॉन सर्जरी, जिसकी सर्जरी हुई है. Even after recovery, he craved for the prescribed medicine. कजन आपका रिकवर हो गया है, फिर भी उसे वो मेडिसिन के लिए वो क्रेव कर रहा है जो उसे डॉक्टर ने प्रिस्क्राइब की थी. What do you conclude about his condition? Had he continued with the same medication? देखो, डॉक्टर ने जब तक दिया था तब तक वो प्रिस्क्रिप्शन के तौर पे दिया था, वो उसकी हेल्थ कंडीशन को इम्प्रूव कर रहा है. लेकिन रिकवरी के बाद भी अगर आपका कजन कंटिन्यू करता है उन ड्रग्स को, तो आप क्या कंक्लूड करोगे उसकी कंडीशन के बारे में? ओके, सो यू कैन से his condition is drug dependence. It is the tendency of the body to manifest a characteristic and unpleasant withdrawal symptom if regular dose of drug is abruptly discontinued. If he is discontinuing it, he is going to exhibit withdrawal symptoms, and because of the perceived benefits, जो उसे benefits लग रहे थे, जो drugs है वो repeatedly person लेता है and become addicted to it. Okay, so this is about the first part. Next, after appraising yourself, what measures will you suggest to him to overcome this problem? Briefly explain any two. तो आपको ये सब पता चला कि उसका ड्रग डिपेंडेंस हो गया है, तो आप क्या मेजर्स सजेस्ट करोगे? सो यू कैन सजेस्ट दीज मेजर्स. ओके, ब्रीफली एक्सप्लेन एनी टू. हियर आई हैव गिवन 3 points, you can write any two, like education and counseling to face problems and stress and to channelize the energy into healthy pursuit. So you will ask him to work upon his or her hobbies like reading, music, yoga, and other activities. Seeking help from parents. Okay, we can counsel the parent, and we can guide the we can seeking help from parents. Parents can be told about the situation and they can guide the person appropriately and immediately. Seeking professional and medical help if required. You have attended a birthday party hosted by one of your classmates. You found some guest at the party sitting in a corner making a lot of noise and consuming something. After a while, one of the boys from the group started screaming, behaving abnormally, and sweating profusely. On inquiry, you found that the group members were taking drugs. ठीक है, तो इसमें बताया है कि आप एक बर्थडे पार्टी अटेंड कर रहे हो, उसमें कुछ गेस्ट जो है वो कॉर्नर में बैठे हैं एंड दे आर मेकिंग नॉइज एंड दे वर कंज्यूमिंग समथिंग. आफ्टर दैट वन ऑफ द बॉय फ्रॉम द ग्रुप वो स्क्रीम करने लगता है, अब नॉर्मल बिहेव कर रहा है, स्वेट कर रहा है. On inquiry, you found that the group members were taking. Would you inform your parents or school authorities? Yes or no? Give reason in support of your answer. Of course, you should inform your the parents or school of authorities so that it does not become a habit by repeated use. If it is not informed, the boy can take it again and will become addicted to it. Consumption of drug may cause harmful effects. Prepare a note to be circulated among the schoolmates about the source and danger of any two drugs. तो आपको एक नोट प्रिपेयर करना है जो आप अपने स्कूलमेट्स को दोगे अबाउट द सोर्स एंड डेंजर ऑफ एनी टू ड्रग्स. कोई भी दो ड्रग, उनके सोर्स क्या है और उनका डेंजर क्या है. Okay, so here you can see like cocaine, source is erythroxylum coca. It affects central nervous system, interferes with the transport of dopamine. Then second drug, opioid, heroin or smack, latex or papaver somniferum, slows down body function. Or you can write cannabinoids, cannabis sativa, affects cardiovascular system. So any two you can write, drug, source and its effect. C. Write any two ways that you will suggest to your school principal so as to promote awareness among the youth against the use of these drugs. तो यूथ में हमें अवेयरनेस क्रिएट करनी है, तो आपको दो वेज सजेस्ट करने हैं टू योर प्रिंसिपल. सो अवेयरनेस कैन बी promoted by organizing poster making competitions, street plays, talk by experts, interviews by experts, etc. Next, what is withdrawal syndrome? List any two symptoms it is characterized by. So withdrawal symptom क्या है? It is the state experienced by addict when their regular dose of alcohol or drug is abruptly discontinued. अगर abruptly discontinue करते हैं तो जो experience करता है addict, that is known as withdrawal syndrome. It is characterized by, तो symptoms बोले हैं, anxiety, shakiness, nausea and sweating. Name a drug used as an effective sedative and painkiller. देखो sedative क्या होते हैं? Depressants होते हैं and painkiller मतलब analgesic. तो यहाँ पे opioids आएंगे. कोई भी एक opioid का नाम आप लिख सकते हो like morphine. ठीक है, तो ये फर्स्ट पार्ट का हो गया morphine. Then for helping patient to cope with mental illness like depression but often misused. Mental illness में hallucinogens are taken like LSD is there. How does the moderate and high dose of cocaine affects the human body? Cocaine when taken in moderate amount, it has a stimulating action on central nervous system. and produces a sense of euphoria and increased energy. Excessive dosage से hallucination. Question number 16. A team of students are preparing to participate in the inter-school sports meet. During a practice session, you find some vials with labels of certain cannabinoids. Will you report to the authorities? Why? Yes, because these may be abused by the sports person. Name a plant from which such chemicals are obtained. So cannabis sativa, cannabinoids है. Write the effect of these chemical on human body. So cannabinoids क्या करते हैं? They affect cardiovascular system of the body. Question number 70. Why is there a fear among the guardians that their adolescent wards may get trapped in drug or alcohol abuse? क्यों fear होता है guardians में कि उनका जो child है that may fall into the trap of drug abuse? Because adolescents are easily affected by peer pressure. ये एक peer pressure is one of the cause. तो जो cause हमने study किए थे वो cause यहाँ आएंगे. इन्हीं causes की वजह से क्या है? The adolescent might fall into the trap of drug abuse. Curiosity, need for adventure, experimentation. ठीक है? So all these television, movies, they all promote drug abuse. Explain addiction and dependence. दोनों की definition आपको लिखनी है. तो addiction है psychological attachment to certain effects of the drug, which gives the feeling of well-being. Dependence is the tendency of the body to show withdrawal symptom if regular dose of alcohol or drug is abruptly discontinued. Question number 18. List harmful effects caused by alcohol and drugs. पहले हम harmful effect alcohol के देखेंगे. It has an anesthetic effect on the consumer, thereby slowing loss of judgment. देखो, alcohol क्या करता है? It affects cerebrum first and later cerebellum. So, cerebrum controls judgment, willpower, emotions. So, all these things, they are not shown. ठीक है? So, judgment, willpower, emotion, antisocial behavior, neuritis. Alcohol is a depressant and it acts on the cerebrum and cerebellum. Cerebellum is the site of memory, thinking, learning, and judgment. So, alcohol causes the loss of judgment, willpower, emotion, antisocial behavior, etc. Then alcohol also acts on the gastrointestinal tract, causing gastritis and peptic ulcers in the intestinal tract. Alcoholic fatty liver is seen, okay, because the metabolism of alcohol is taking place in the liver, so it affects the health of the liver and causes liver cirrhosis. It causes increased blood pressure and cardiovascular problem. Now coming to harmful effects of drugs, so these are chemical compounds acting either as depressants or stimulants. Excess consumption may lead to death due to blocking of respiratory tract. Vision and power of judgment is lost. Cardiovascular problem may lead to death, and LSD may lead to fetal and chromosomal abnormalities. So these few points you can learn and by heart. Next question, question number 19. In your view, what motivates youngsters to take alcohol or drugs and how can this be avoided? आपके व्यू में यंगस्टर्स को क्या चीजें मोटिवेट करती है ड्रग अब्यूज या अल्कोहल अब्यूज के लिए? The motivating factors are peer pressure, desire of excitement, liking of taste, escape mechanism from frustration, history in the family, curiosity due to advertisements. How it is avoided? दो चीजें हमें बतानी है. What motivates and how can this be avoided? So it can be avoided through proper peer consultation, identifying the reason for such consumption, providing proper education and counseling, maintaining physical fitness. How can the drug or alcohol abuse be prevented? Again, it is all the same points will be there. Next, prevention is better than cure is an apt slogan to safeguard adolescent from drug abuse. List any 6 steps that could be taken in this regard. Okay, so what steps we can take so that the adolescent we can avoid consuming drugs? So education and awareness is the first step. Then avoiding undue peer pressure, regular monitoring of the activities of adolescent. Parents must channelize the energy of an individual into various recreational activities like sports, music, and other activities. If required, parents must consult professionals and medical people, experts, and to guide the youth. Parents must be able to identify the motivations for alcohol and drug abuse in the upcoming generation and keep a check. So, this is all about the topic drug and alcohol abuse. Hope the things must be clear to you. With this, we completed chapter 8 revision. All the best for your exams. Stay connected. And if you like the video, please do subscribe my channel. Thank you, everyone.